Good morning, everyone. We just wanted to give you an update. We know everybody's getting updates from the federal government, from the president, and from the Governor Beshear, and we just wanted to give you some updates here in what's going on in Grayson County. And first of all, I want to let everyone know that we had a report there was some text that went out yesterday that we had a positive case in Grayson County. That was actually Grayson County, Texas. That was not in Grayson County, Kentucky. So that is false. That is not Grayson County, Kentucky. That was Grayson County, Texas. So we just want to get that out there and let everybody know that it was not here. Next up, I want to let Josh Emery, the director of the Grayson County Health Department, talk to you here a little bit. There's been changes going on seems like every hour we're getting something new. So we just sort of want to let everybody know what's going on here in Grayson County, what you need to do in case you think you've been infected or you've been in contact with someone that's been infected with COVID-19. So first we'll have Josh Embry.
All right, well, thank you, Judge. And just to share some information with the public on what's going on exactly with the health department. So I would like to report that we have received supplies from the Strategic National Supply, and that is a federal stockpile of personal protective equipment that we can tap into in an emergency, which we have considered this, of course, a public health emergency. That PPE has been sent down from the federal level to the state level, dispersed from the state to the county government as well as the local health departments to disperse out as needed. So this is something great. This shows ongoing collaboration between the federal, state, and local county government. That PPE has been delivered here at the local front in the county. I know for a fact one of our nursing homes that needed N95 masks was able to get those masks through the SNS, and so we're very thankful for the Strategic National Supply. Testing in the state has increased substantially. The numbers this morning stood at 1,866 people within the state of Kentucky that have been tested. The majority of those tests have been conducted through commercial labs. Only 1/3 of the testing has actually come from the state labs. This is actually a good sign because it shows that doctors are ordering these tests more frequently in their offices. However, yesterday I did get on LabCorp's website just to look at the requirements to see if they've changed for those tests to go through them. And they are still saying that people have to be symptomatic before those tests can occur. I would also like to highlight some possibilities with commercial labs. As I said, this is very good. However, some of these labs have got into the business of testing for COVID-19 rather quickly. And it is my fear as public health director that some of them may not understand that the state and local officials need to know about positives before the general public. So today on K105, I was reading an article about down in Muhlenberg County, and I haven't confirmed this. It's only a strong suspicion that in this article it was talking about that there were 2 confirmed positive cases that the state had not reported. And my thoughts are that those were probably conducted by commercial labs, and that information was not pushed out to the state so we could inform you. The next thing I'll say is the governor's executive order has went into effect as of last night at 8. Non-essential businesses were ordered to close, and we're asking for community-wide participation in that. We understand that it is it's very tough for our small business owners, but I've been very uplifted to see the ongoing participation and wanting to see us drive back this virus. So it's only fair that all businesses comply. If you see a business that is non-compliant, the state has put out a number for you to call and report. That number is 1-833-KY-SAFER. That's 1-833-KY-SAFER. The health department has also instituted a hotline to free up our regular lines for everyday regular business. And this hotline is specific for COVID questions. That number is 270-899-0467. Once again, 270-899-0467. And that number is open Monday through Wednesday, 7:30 a.m. to 4:30 p.m., Thursday, 7:30 a.m. to 4 p.m., and Friday, 7:30 to 11 a.m. Positive cases are the inevitable. I would like to say that we were able or will be able to protect the county from positive cases of COVID-19. However, that's simply unrealistic. So as these tests ramp up, as these public labs, commercial labs continue to test and increase their capabilities, we will most likely see positive cases in the county. However, I am stressing the importance of not panicking, and I'm sure the judge will say the same thing when this happens, because we've known it is the direction we've been going for quite some time. So here's what I say to you in closing. Continue to follow quarantine measures. If you don't need to go somewhere, if you don't have the essential needs, please stay home and quarantine yourself. And you're not only doing it for yourself, but you're doing it for those vulnerable populations. If you come in contact with somebody that is later tested to be positive, it's important that you quarantine yourself for up to 2 weeks. We understand that this is going to be a concern going forward, because as we see more testing, more positive results, the likelihood of someone coming in contact with somebody who tests positive increases. So what do? You self-quarantine for 2 weeks. If you start to develop symptoms, call your local doctor, tell them what's going on. Don't just go to their office. And if he or she thinks that you need a test, they will order you a test. The last thing I'll say is we are addressing harmful rumors in the community. There have been several harmful rumors that have impacted an influx of calls at the health department, and I'm sure other county offices. We've created a page at graysonhealthcenter.org/isittrue. graysonhealthcenter.org/isittrue. We're trying to stay on top of those rumors, so if you hear something that just doesn't seem right, go to that website, and if we don't have it listed, let us know through social media, and we'll try to see whether or not it's true, and we'll post it as a harmful rumor if it is. As always, we are available online at www.graysonhealthcenter.org. Our regular number is 270-259-3141. Thank you.
Josh, before you, does anybody got any questions?
Any questions? Yeah, I always forget that.
And are you telling people, we're telling people now to go to their primary care physician, right?
Yes.
Give them a call first.
Yes, if you feel like you've been exposed or you're starting to have symptoms, call your primary doctor, tell them what's going on, and they will set up some procedures for you to do to get the test. I've heard of some, things as unique in the state as people going and them having the patient set out in the car and them coming out to test them. So just call your doctor, let them know the situation. Don't just show up. Don't just show up at an ER unless it's a true emergency. And again, if you have any questions, let us know. Yes?
Do you want to reiterate what symptoms are for people with
Yes.
allergy season going on?
The symptoms, coughing, it's very flu-like symptoms. The only difference is with this virus is there's a difficulty to breathe. So a lot of patients who have tested positive they've had to be put on oxygen to breathe and get assistance. So that's the big difference, is the shortness of breath that occurs with this virus. Besides that, it mimics the flu a lot, which I know is not very convenient. So that's a really good point. The next thing I'll say is that what doctors typically do and what the states want us to do, if somebody has symptoms, they want us to do a flu test to see if they're negative before we go ahead and do the COVID test, because the symptoms are so similar. Any more questions? Okay, thank you, Judge.
Thank you, Josh. Remember, if was there a question on there, Sam, about where people get tested? Do exactly what he said. Call your primary care physician and let them know what's going on. And right now, we don't have here, as far as any drive-through testing facilities or anything like that. We don't know. We don't know what's going to happen tomorrow, let alone in the next hour. So we could possibly have that here. We just don't know at this time. As of right now, we don't have any facilities up and going unless you're showing symptoms and you need to contact your local health care provider. So some other things I've got on the agenda here, as far as some questions that people's called and asked. Grayson County Schools are still doing the Meals on Wheels. I think they've done an outstanding job. We've said nobody in Grayson County is going to go hungry, so and we stand by that with the help of the school system and with Grayson County Alliance with the food pantry. You can go to www.graysoncountyschools.com to find out their schedule. I think they have already updated that with some new locations. And you can also give them a call at any of the schools. Someone is manning the phones there. Also, school kids, if you're having trouble with your schoolwork, just give them a call. And I've seen probably every teacher in the county, I guess, on Facebook saying, hey, if you need help, give me a call. They've all stepped up to the challenge, and I mean, they're all willing to help. And so the only thing you got to do is get in contact with one of them. Factories operating. We've had a lot of calls about factories operating. Folks, I don't quite know why I'm just listening to the medical professionals and what the state is sending down. We don't know why some factories have not shut down. We don't know they're continuing to run. I'm sure it's because of the economy, and because that's something else that we're going to have to deal with after this is over. But most all factories we've got here in the county are operating on normal hours with precautions that is set down by the CDC, and they are working with the Human Resources departments. There is 3 that we have, and there could be more now today. Like I said, this could be something that has changed. Bell Brands is normal operating hours. Bell Cheese, Bell Brands, normal operating hours with precautions, except they are running partial shifts. So Bell Brands is running partial shifts. So if you work at one of these factories, and just give your HR people a call, let them know. MTD, they was operating with precautions, normal hours, but except the production line has shut down. Maintenance, distributors, and shipping and receiving are going as normal at this time. Of course, like I say, folks, just get in contact with these people because this is changing day to day. So, but that's what we have right now. Plasticon, they will be closed for 2 weeks. I think this is because of Toyota shutting down as well. So, and they will reopen for work on April the 6th. But we ask you once again to contact the HR department to make sure, because this is something that could change as well. So, but every other factory we have in the community here in Grayson County, they are operating normal schedules with precautions related to the CDC and their Human Resource Department. So any questions, I just feel that you need to contact them. The food pantry, I've talked to Debbie. She's got 70 more meals that she's done last week, and we've actually got a lot of the magistrates that we have here have stepped up, and they're trying to help her out a little bit, and has volunteered some of their time to do some things. And we've also got some of our maintenance employees with the county that's helping deliver food. She had about 100 to 120 seniors that did not didn't pick up last week, so we're sort of was concerned about the seniors, and so Debbie started making phone calls and getting all of our getting her stuff together over there with the food, and we started making deliveries to them. So once again, you know, she said, and I say too, nobody in Grayson County has to be hungry. So if you have any questions for her, call her at 270-259-4000. 259-4000, Debbie Childress, and we will do whatever we can to get our seniors taken care of. And I think her hours now, like I said, these could change, is pickups to do the drive-through pickups is Tuesday from 9 a.m. to 2 p.m. and on Thursday from 2 p.m. to 6 p.m. Now, we'll put something out, and she's also got some stuff out on Facebook and her webpage also to make sure that folks know when to pick up. And I think we are delivering with help of the jailer, Jason Woosley, is helping with some of his folks that was on the work release program that was watching the deputies that watch the guys that do the mowing on the side of the roads. They're actually helping do some deliveries and working over at the food pantry as well. Okay, next is Community Alliance. They are actually, I think I misspoke last week, they actually do the heating assistance and some rent assistance and that type stuff. You can give them a call at 270-259-3500, 270-259-3500. And if someone knows someone that is that's homeless or they're out on the street right now, they can actually help with that also. We actually try to call 8 a.m. to 4 p.m. and Tracy and Melissa will try to help you out with that. Their CATS transportation, that number is 800-242-8225. That's 800-242-8225. That is for CATS transportation with Community Alliance, or Community Action, I'm sorry, Community Action. I apologize for that, Community Action. And they will try to get you taken care of if you ain't got ways to and from the doctor's office and that sort of thing. So next we have, I just wanted to let everyone know that I know federal government and the governor has asked everyone to step up a little bit and do what you can. And we've got in contact with Fair Share Manufacturing here in the county. And Mike and Rose, I've talked to Mike this morning, and he's actually made, I think they made about 200 masks for a local, I believe it was a pediatric center that they made some masks for. And like Josh said, we are getting some materials in and some equipment in, some of the PPE for the first responders, the ambulance service, the hospital, the nursing homes, and some other folks. So, and I think we're going to be getting another shipment of that this week, which is great because we got some last Thursday, which worked out great. And but Mike has stepped up, and they're actually making some of these masks for other communities as well. They've called in some orders, so they've sort of shifted their lines to making masks. So we're going to try to save some here at the judge's office, and we're also going to see. I've had some people call that's got some children's got underlying conditions, and also other folks that's had cancer and they'd be susceptible to this. And we want to try to get those folks, if you can't find a mask, please just call one of us here, 259-5000, or the health department number, and we'll try to get you some if you have to be out for any reason, or if someone has been out and you want to protect yourself at home. The new executive order by the governor came out yesterday. I just wanted to talk a little bit about that, what it's affecting with us. Most people have seen this. I think you all, Rebecca and Matt, you're all going to print this, I'm assuming, where what's to be closed and not to be closed. everything can stay open: grocery stores, supermarkets, specialty food stores, meat markets, fish and seafood markets, fruit and vegetable markets, and liquor stores. So that's yes. And pharmacies for pharmaceutical use, yes. They've closed the cosmetic, beauty supplies, optimal goods, health and personal care stores to be closed, clothing stores to be closed, shoe stores, jewelry stores, luggage, leather goods, etc. to be closed. Most everyone probably knows whether they need to be closed or not, and he also put on the order that you can do curbside service, and so you can stay open, folks. You just man your telephone, and if someone needs anything, I know some of the local furniture stores here. You know, I know everybody sort of wants to look at it in person, but you know, if you really need something, appliance or anything, you can actually call our local appliance stores, and they can still deliver at this point. So we're just following what the state sends down. So if there's any questions that if we haven't got the answer to, we'll try to find the answer to them. I know that some of the local news stations here has put the numbers up of all the local offices, the clerk's office, the jail, the county court clerk's office, and PVA office, my office, the county or the Grayson County Health Department's office. If anybody would like to look at these, please just you can visit our website at gcky.org. We just got that up last week to try to help folks out, and it's got some different links to it to try to help folks out a little bit. It's got everything that I'd mentioned in this past conference here that you've got access to that. Also, just to let everyone know, we're still getting road complaints here at my office, which we will continue to take those. Those guys are running about 2 to 3 weeks behind. We don't know what's going to happen next, but we are still at this time, we're ditching and we are repairing roads and that type thing. As far as resealing or repaving or chip and sealing roads, we don't know where we're going to be at this point. We're not doing anything because we can't get material right now because of the time of year it is. And quite honestly, we don't know exactly where, if we are going to be able to get those materials. So also, I encourage everyone, I talked with Congressman Guthrie yesterday and called Senator McConnell's office, and I urge them, because I've had a lot of folks that have lost their jobs and lost their business because they're self-employed, and I have urged them to put in the stimulus package for self-employed to be able to receive unemployment benefits, because these folks do not receive unemployment benefits because you were self-employed. I'm talking about the hairstylist, anyone that's self-employed, basically. They assured me that they are working on that, and that they will probably be more stimulus bills and packages that will come later on down the road. Like I said, we're in uncharted territory here, and quite honestly, it's just a day-by-day thing. But I encourage you to give their office a call. I just want to remind everyone to please do not panic. I understand there's a lot of people that's upset because they're shutting these businesses down, and you go to Walmart and a lot of people are packed in there. I understand that they're going to have to keep the grocery stores open, the pharmacies open, and hopefully someone will come to a conclusion on why we need to pack in some businesses real tight and some we don't, and we just want to follow what the state and the federal government sends down and what the CDC recommends. So thanks to everyone that's been impacted by this. I know it has uprooted a lot of people and turned everybody's lives upside down. It also has mine, and it's quite honestly, we didn't know if we ever have to deal with something like this, but we are, and we will get through it. and we will all get through it together. And I want to thank everyone, and I want to let our county attorney go over a few things with everyone here right now, but thank you for tuning in.
Thank you, Kevin. Good morning, everyone. I'm Jeremy Loxton. I'm the county attorney here in Grayson County. I just want to speak a little bit concerning a specific subject. Before I get to that, we've heard that these are unprecedented times, and not since the Civil War or the Spanish flu of 1918 have we had to deal with such challenges. I've been inspired by the operations of several county officials, healthcare officials, and private sector members who've really stepped up. You know, they used to say that a stitch in time saves 9. Well, that's kind of where we're at now. We're trying to do major prevention efforts, and we're trying to make sure that what's coming down from the state is executed here locally so that we can do what we're supposed to be doing, which is ultimately save lives. With that in mind, what I've came here to discuss is called self-isolation. The cases are not here yet, but you can be assured that they are on their way. You don't have to study history to see what is coming our way. I watch Italy, I watch Spain very closely. That's what we are trying to prevent, numerous deaths. The Spanish flu in 1918 to 1920 eliminated 27% of the population of the world. 27% of Grayson County would be 7,000 people. We do not believe that's going to take place because, as history has shown us, we can learn from the past. These prevention measures, I believe most people are starting to understand, are not only necessary, but are crucial. When people go to be tested at the local hospital, after they're tested, they don't know if they're positive or negative right away. They have to wait for a little bit of time. After you're tested, say you walk to the hospital, your doctor's referred you for a test, you've got some symptoms, they're going to the health department is going to give you a self-isolation form. It's an agreed order. Basically, it lays out that after you're tested, they're requesting that you voluntarily self-isolate at home if you don't have serious symptoms, away from people, not travel, or, if you do have symptoms that required hospitalization, that you will agree to be quarantined, that you'll be put in a separate place so that does not spread. At this time, we have 0 cases. But when we do have those cases, things are going to change and we're going to adapt quickly. I've seen the team. These people don't know they're on a team, these community leaders, but they are. And I've seen these independent pieces acting and connecting together to create a net that is really going to help when these cases come. My purpose in speaking to you is to educate you a little bit concerning that self-isolation. We're asking you to agree to do that. If you do not agree, then I, as a county attorney, will have to go to the circuit judge, to the circuit court, to ask for a forced quarantine order. We've had 2 individuals in the Commonwealth that have done this in the past 2 weeks, one in Jefferson and one in Nelson County. They didn't use the common sense they needed to. And without using that common sense is what can cause the sickness and cause us to lose our family members and friends very quickly. Now, that process is already in effect. People are being asked to self-isolate if they test. At this point, once again, no positive test. However, there are people out there that are being self-isolated as we speak. Further, I'd like to reiterate the telephone number that the judge gave you concerning businesses that are operating, that are non-essential, that you believe are not complying with executive order is 1-833-597-2327. I think by making these necessary steps and supporting and saying prayers for those community leaders that are helping to prevent this, and the healthcare workers and the emergency workers and everyone involved, is crucial. And by the end of this, we know that we'll be Grayson County strong and Grayson County proud. Thank you.
Thank you, Jeremy. One more thing. I got to look at some of the questions on K105's website here, and people saying, somebody said something about some meat processing centers here in the county. And yes, I think we have 2 or 3 actually, one at Wax and one at Caneyville. So, and I think, I don't know, I know one of them has and they're selling, but I don't know about the other. But I believe one of them is Ray's and the other one is CNC and Wax. I don't have their numbers. I apologize. It was just a question that came up that I'd seen on there that, you know, if you're having trouble getting, you know, hamburger meat or something like that, that's somebody else you can reach out to try to see if that could, you know, help you or help your family. Also, Small Business Administration loans, I think it's SBA.com. And there was, I'd put something out, and I knew there was a couple people that, you know, said that wasn't a really good deal, and you know, I understand. But now, from what I've been told when I talked to the congressman's office and the senator's office, that some of these loans will more than likely turn into grants, and that loan will be unforgiven. Now, I want you to be sure and do your research and be sure and ask those folks when you call. But here in the next couple hours, I'll go ahead and add a link to GraysonGCKY.org. Down at the bottom of the page, we'll give you a link to Small Business Administration where you can, you know, fill out for those type loans. So y'all got any other questions, you guys? Nothing? All right. Like, once again, I appreciate everyone tuning in. Like I said, this is going to change daily. It's going to change for us here in the county daily. We're just trying to keep everybody updated with what's going on inside Grayson County. I know everybody's keeping up with what the governor's doing and what the president's doing, and quite honestly, I mean, I know their plan is changing hourly. So we're just trying to keep up with what's going on here and let people be informed of what's available in Grayson County and what we're trying to do. We know it's inconvenient, and we understand that, and but we will get through this. We're Grayson County strong, and we're going to stay that way. So if anyone needs anything, please reach out to us at the office, 259-5000. We will get you and who you need to get in touch with. Thank you so much.